Good morning. My name is Trisha Nunez, a midwifery student, and today I will be talking about pregnancy. So, what is pregnancy? Pregnancy occurs when a sperm fertilizes an egg after its release from the ovary during ovulation. The fertilized egg then travels down into the uterus, where implantation occurs. A successful implantation results in pregnancy. On an average, a full-term pregnancy lasts 40 weeks. There are many factors that can affect a pregnancy. Women who receive an early pregnancy diagnosis and prenatal care are more likely to experience a healthy pregnancy and give birth to a healthy baby. During full pregnancy term, it is important for monitoring both the mother's health and the baby. Symptoms of pregnancy. A pregnant woman may notice some signs and symptoms before she takes a pregnancy test. Others will appear weeks later as their hormone levels change. Missed period. A missed period is one of the earliest symptoms of pregnancy. However, a missed period doesn't necessarily mean that you are pregnant, especially if your cycle tends to be irregular. Headache. Headaches are common in early pregnancy. They are usually caused by altered hormone levels and increased blood volume. Spotting. Some women may experience light bleeding and spotting in early pregnancy. This bleeding is most often the result of implantation, usually occurs 1 to 2 weeks after fertilization. Early pregnancy bleeding can also result from relatively minor conditions such as an infection or irritation. Bleeding can also sometimes sign a serious pregnancy complication, such as miscarriage, ectopic pregnancy, or placenta previa. Weight gain. A pregnant woman may expect to gain between 1 and 4 pounds in her few months of pregnancy. Weight becomes more noticeable toward the beginning of their second trimester. Pregnancy-induced hypertension. High blood pressure or hypertension sometimes develops during pregnancy. A number of factors that can increase the risk including being overweight or obese, smoking, family history of pregnancy-induced hypertension. Heartburn. Hormones released during pregnancy can sometimes relax the valve between the stomach and the esophagus. When stomach acid leaks out, this can result in heartburn. Constipation. Hormone changes during early pregnancy can slow down the digestive system of a pregnant woman. As a result, pregnant women may feel constipated. Cramps. As the muscle in the uterus begins to stretch and expand, the pregnant woman may feel a pulling sensation that resembles menstrual cramps. If spotting or bleeding occurs alongside with cramps, it could be a signal of miscarriage or an ectopic pregnancy. Back pain. Hormones and stress on the muscles are the biggest causes of back pain in early pregnancy. Increased weight and shifted center of gravity may add back pain to pregnant women. Around half of all pregnant women report back pain during their pregnancy. Anemia. Pregnant women may have an increase of anemia which causes symptoms such as lightheadedness and dizziness. The condition can lead to premature birth and low birth weight. Prenatal care usually involves screening for anemia. Depression. Between 14 and 23% of all pregnant women develop depression during their pregnancy. Pregnant women may experience many biological and emotional changes. Insomnia. Insomnia is another common symptom of early pregnancy. Stress, physical discomfort, and hormonal changes can be contributing causes. A balanced diet, good sleep habits, and yoga stretches can all help get a good night's sleep for pregnant women. Breast changes. Breast changes are one of the first noticeable signs of pregnancy. Breast may feel tender, swollen, and generally heavy or full. The nipples may also become larger and more sensitive, and the areola may darken. Acne. Because of increased androgen hormones, many women experience acne in early pregnancy. These hormones can make the skin oilier, which can clog pores. Pregnancy acne is usually temporary and clears up after the baby is born. Vomiting or morning sickness. Vomiting is a component of morning sickness, a common symptom that usually appears within the first 4 months. Morning sickness is often the first sign of pregnancy in women. Increased hormones during early pregnancy are the main cause. Hip pain. Hip pain is common during pregnancy and tends to increase in late pregnancy. It can have a variety of causes including pressure on the ligaments, sciatica, changes in posture, and a heavier uterus. Diarrhea. Diarrhea and other digestive difficulties occur frequently during pregnancy. Hormone changes, a different diet, and added stress are all possible explanations. If diarrhea lasts more than a few days, contact the doctor to make sure the pregnant don't become dehydrated. Stress and pregnancy. While pregnancy is usually a happy time, it can also be a source of stress. A new baby means big changes to a woman's body, personal relationship, and even finances. Don't hesitate to ask your doctor for help if you begin to feel overwhelmed. Pregnancy test. Pregnancy is diagnosed by measuring the body's level of human chorionic gonadotropin or the HCG, also referred to as the pregnancy hormone. HCG is produced upon implantation. However, it may not be detected until after a woman misses a period. HCG is detected through either a urine or a blood test. The sooner the woman is confirmed pregnant, the better. An early diagnosis will allow to take better care of a baby's health. Pregnancy diet. A healthy pregnancy diet should be much the same as your typical healthy diet. Only 340 to 450 additional calories per day. Aim for a healthy mix of foods including complex carbohydrates, protein, vegetables and fruits, grains and legumes, and healthy fats. If you already eat a healthy diet, you only need to make slight changes. Fluids, fiber, and iron-rich foods are especially important during pregnancy. Vitamins and minerals. Pregnant women require larger amount of some vitamins and minerals than women who aren't pregnant. Folic acid and zinc are just two examples. Once you are pregnant, you may wish to increase your vitamin and mineral intake with the help of supplements. Pregnancy and exercise. Exercise is essential to keeping a pregnant woman fit, relaxed, and ready for labor. Yoga stretches in particular will help stay limber. Other good exercises for pregnancy are gentle pilates, walking, and swimming. Pregnancy complications. Pregnancy complications can involve the baby's health, the mother's health, or both. They can occur during pregnancy or delivery. Common pregnancy complications include high blood pressure, gestational diabetes, preeclampsia, preterm labor, and a miscarriage. Pregnancy labor. Sometime after the 4th month of pregnancy, a pregnant woman may begin to experience Braxton Hicks contractions or false labor. They're completely normal and serve to prepare the uterus for the job ahead of real labor. Early labor. Labor contractions are generally classified as early labor and active labor contractions. Early labor contraction lasts between 30 to 45 seconds. Water might break during early labor or the doctor may break it. Active labor. In active labor, the cervix dilates and the contractions get closer together and become more intense. If you're in an active labor, you should call your healthcare provider and head to your birthing setting. Labor pain. Pain will be at its height during active labor. Pregnant women may choose drug-free measures such as meditation, yoga, or listening to music. Pregnant women may manage pain with drugs. Epidural prevents certain muscle movement and completely block the pain. The bottom line. Whether a pregnant woman is planning for a vaginal or cesarean delivery, Pregnant women may feel nervous as her due date approaches.